really sure, but I just knew my whole life that's what I wanted to do. From a little girl, I always wanted to be a nurse. And so when I went into high school, then I just kind of started taking classes that were geared toward that. I took like a medical assistant program, got a job junior year in a medical office, just something that I always knew, and I know that's not really normal for most people. Most people don't really know what they want to do, but I always did, so I was lucky. My job responsibilities basically are caring for the patients, also being an advocate between the parents and the doctors, because a lot of times the parents aren't there to see the doctor when they do their rounds, so we take that responsibility on of finding out what the parents need to know and just talking between the doctor and the patient, the parents. But basically, it's hands-on patient care, making patients comfortable and keeping them well and alive. Well, for nursing in general, a bachelor's degree is now, there used to be where you could get an associate's degree, you could get a 2-year degree, but now I think that they're only hiring a bachelor, so which is a 4-year degree if you want to specialize in the neonatal intensive care. At this time, there's no extra education needed to get into that. However, I think they're starting to require certification in NICU, which most of our nurses now are certified in the NICU. But a bachelor's degree is the minimum where you should start for a degree in nursing, and especially in the NICU. My typical day in an ICU, there's no such thing as a typical day. You could walk in and your day could start out very simply, thinking you're going to have a nice coasting day, just making your patients comfortable and giving them what they need, and it can turn upside down in a split second. Basically, we just go in, we take report on our patient load for the day, and just kind of go from there, because we never know when we're going to get an admission either. Sometimes that can turn things upside down as well. So I guess there's not really a typical day in an NICU. Technology, wow, we have a lot of technology actually, and a lot of technology over the years has changed too. Most of the time we are using respiratory things, ventilators, all kinds of devices to help the babies breathe. So whether it be a ventilator or cannula, oxygen where we give flow, a lot of IV pumps, monitors, medical fusion pumps, lots of technology. Another important technology, I guess, that I failed to mention was computers. I mean, we do everything on computers now, which is so much different than penciling, papering, and all that stuff that we were used to in the beginning. So technology, computer technology is very big. Or the positives of my job is seeing how over the years, over the past 20-some years, how things have changed, how we've been able to save a baby born very, very early and have them have a good quality of life. Where in the past we would save them and maybe their quality wouldn't be so good. So we've come a long way in technology for that. The negatives are, I guess, the same thing, the technology, because we have so much good technology that we can save these babies, and not always is the outcome one that we would want for our own children. So the technology thing, I guess, has its ups, is the positive and the negative about what we do. What advice would I give? I would say, I would recommend it to anybody actually. I mean, I couldn't think of a more rewarding occupation or out there. But my advice would be that you person. You have to be in this profession in general. You need to be more curious than judgmental. There's a lot of different life's journeys out there, people that you come in contact with, and you have to be able to. I don't like this question because I don't really know what advice I would give. I guess I would say go for it. I mean, it's the best job out there.